mercy. Well, I think we're all present, so we can get going. Good morning. Throughout the past 4+ years, this administration has been squarely focused on building our infrastructure, strengthening our economy, investing in education, workforce development, training programs, et cetera, great government service, obviously making investments in protecting and promoting our public health. We're simply trying to build the best state in the country to live, work, play, study, and hopefully stay and grow deep roots here. And every one of those activities is, just by the very definition of life, is tethered to good health. Both, when we look at it from a state perspective, both physical and the fiscal health of our state. Health is wealth. And so we're going to continue to lean in on this, not just because it's so important today, but it's always has been, and the decisions we're making over the course of the remainder of this administration, we want them to be able to inform where the state is going for a much longer period than that. We've made progress on various initiatives, such as, and I'm so proud of this, infant mortality. Still a lot of work to do on that front, but we've seen examples of really taking a deep dive into an area and doing things differently to get a different result. And so we're encouraged by that. And Dr. Box and her team and all of our public health professionals across the state of Indiana, both local and state, they're the very backbone of all of these efforts. And the pandemic has just further, obviously, highlighted the need to make sure we're doing everything, not just efficiently, but that is leading to a good result. We've dealt with so many stresses and strains to the system that we believe that this is the absolute right time to be leaning into this space. Obviously, there are different challenges for individuals, for families, for businesses when it comes to the health of Hoosiers and to their workforce, knowing that we consistently rank not in the top 10. Some things haven't changed, Dr. Monroe, not in the top 10, but in the bottom 10 in terms of obesity and smoking and childhood immunizations. So again, addressing these challenges holistically, I'm pretty excited about, and to make sure that we're looking at all of the funding, the operations, the structure of how we promote good health. Now, we have 94 different health departments around the state of Indiana. Obviously, that accents different approaches, different resource levels. There's very little standardization that occurs across the whole system, again, either in resources or approaches at that very localized level. Our system's been in place for about, the one that we have right now, for about 140 years. So obviously, in terms of how we operate, how we fund, how we structure, critically important to the outcome. This assignment, again, not just timely, but our intent and our hope and what will drive us is this is going to lead to a better system over the next 100 years, knowing from where we've come from for the last 140 and how we've operated. I know it's not going to be easy. I know it's not, can't be done in a vacuum. And so that's why we've assembled the Governor's Public Health Commission that will go out over the course of the upcoming year, starting this summer. We'll wrap up next summer. And it's going to be led by people who have been there, done that. 15-member commission led by two co-chairs, Senator Luke Kenley, long known for his expertise in multiple issues in very complex fronts, on complex fronts. And also to his side, Dr. Judy Monroe, who served from 2005 to 2010 as our State Department of Health Commissioner herself, and now serves as the president and the CEO of the CDC Foundation. That's the foundation. That's the nonprofit wing of the CDC. So again, I'll just, before I turn it over to someone who needs no introduction, the task ahead couldn't be more important, and the time of the work that's going to be conducted couldn't be more pressing. You might say that this is our Achilles heel, and we're not alone in this in the country. And I'm excited that Dr. Box will be at the side of this commission working hand in glove to make sure that by the end of the year, we've got some very solid recommendations for our partners in the legislature and our partners throughout the state of Indiana in their local areas of responsibility. So with that, I will turn it over to Dr. Box.
Thank you, Governor. This is an incredibly exciting and important initiative that has the ability to transform health for Hoosiers all over our state and every corner of our state. When we look at what contributes to our overall health, having access to clinical health really only accounts for about 10% of how healthy we are. Approximately 20% is determined by our environment, where we live and we work and we play. 50% is determined by our behaviors, such as whether we smoke, do we exercise, do we watch our diet. For example, a lack of access to good education and job training, a lack of access to safe and secure housing and healthy food supply can become barriers to individual Hoosiers achieving their optimal health. The best way to improve Hoosiers' health and reduce those disparities is to focus on those behaviors and those circumstances that can prevent issues before they require medical care. And that is truly the heart of public health. As the governor already noted, Indiana has 94 local health departments, and they're the foundation of public health services in the state of Indiana. Yet their resources vary widely. I had the opportunity my first year to go out and see every local health department and meet so many of our public health servants across the state of Indiana. We have some larger departments that have hundreds of staff members, while smaller counties may be lucky to have 3 to 6 full-time members, and sometimes many of those are part-time. Regardless of their size, these departments are still responsible for providing immunizations, making sure that we have access to our birth and our death certificates, investigating and following up when there's a disease outbreak, like the last 18 months, cleaning up methamphetamine labs, and doing many other things like addressing elevated lead levels in our children. They're also required to issue permits for septic systems, inspect and license restaurants, and respond to other environmental concerns. Some of these departments are simply unable to perform all of these duties that they're required to do by law. Their resources are stretched thin in the best of times, and carrying out these required duties during a pandemic has become a Herculean task. I am incredibly proud of the work that each and every one of our local health departments has done throughout this pandemic. Our public health workforce is made up of some of the most dedicated people you will ever meet and encounter. They truly are passionate and care about their communities. They've lost sleep, sacrificed their own health, and given up time with their families to help protect others. They deserve all of our thanks. But they also deserve our help, and that is the goal of this commission. By taking a deep dive into the strengths and the weaknesses of Indiana's public health system, we believe that we'll be able to identify ways to better support public health, reduce health disparities, and ensure that where you live will not be the determining factor with regards to your access of the public health services you can receive. We don't plan to waste any time moving forward. We've already begun reaching out to individuals to serve on the commission, and we're engaging with our CDC's Center for State and Tribal, Local, and Territorial Support and Association of State and Territorial Health Officers for their national perspectives on best practices. Our goal is to have an inaugural meeting in September with representatives from these groups to establish task forces that will take deeper dives into the areas that comprise the components of public health. Those task forces will examine issues such as governance, emergency preparedness, funding, workforce, how we collect and use data to drive quality improvement in public health across the state, and how we serve our children across the state. The Commission is expected to meet monthly to review the progress of the task forces, and in addition, we plan to conduct listening tours across the state of Indiana to gather more information and input from our community leaders. Our goal is to have a report by late next summer and then to share that information around the state. We fully expect this work to result in recommendations for updates to our public health statutes, and we look forward to working with our legislators to improve Indiana's public health system. This will be a collaborative process, and the final recommendations will reflect an incredible investment by local, state, and national leaders and experts in their field. We're incredibly blessed to have two of those experts here with us today and throughout this process. I want you to be able to hear from Senator Kenley and Dr. Monroe, and it's my distinct pleasure to now be able to introduce Dr. Judy Monroe.
Thank you, Dr. Box, and thank you for your leadership and dedication to public health here in Indiana. So I will tell you, it's really nice to be back home in Indiana today, and I very much enjoyed and appreciated being your state health officer under Governor Mitch Daniels, which makes today especially exciting for me for this important launch aimed at improving public health moving forward here in Indiana. I commend Governor Holcomb for your very strong leadership, taking this on and prioritizing this critical work. Public health infrastructure is vital to Indiana, but it's vital to our nation at large and every state across the nation. The public's health protection is something that we all should care about, and it's something that every citizen should have access to high-quality public health services, as Dr. Box said, regardless of where you live. So the pandemic has taught us many lessons, and it has stress-tested our health departments in Indiana, but across the nation. Our hospitals have been stress-tested, our businesses, our schools, and all of us as individuals. So these are important lessons that moving forward we will want to apply to the work of the Commission as we do our deep dive. It's also my privilege and honor to serve as co-chair of the Governor's Commission on Public Health with Senator Luke Kenley. I had the chance, of course, to work with Senator Kenley during my time as Health Commissioner. So when I left Indiana in 2010, I left to move to Atlanta to become Deputy Director at CDC and the Director of the Office of State, Tribal, Local, and Territorial Support. That's the office at CDC that supports all the health departments across the nation. So I will tell you, over the last few years, I have visited a lot of health departments. Then in 2016, the CDC Foundation Board of Directors, which is an independent nonprofit, named me to be their president and CEO. And just before the pandemic, actually in the fall of 2019, our board convened to talk about priorities for the foundation. How could we, as a nonprofit that supports public health, what priorities should we be focusing on? And the number one priority that the board determined was strengthening the public health system. We also talked a lot about data modernization and prioritizing that, which is part of strengthening public health system and the workforce of public health, in addition to health security and having an equity lens in the work that we do. So when I went to my board, after Dr. Box had called me about this, I went to my board and asked what they thought about me co-chairing the commission, and it was an easy decision for them because they said it's squarely aligned with the priorities that we set even prior to the pandemic. And I know that Indiana, you've talked about this prior to the pandemic as well. The foundation is an independent nonprofit, as I mentioned. It was created by Congress to help support CDC and the public health system at large. And we do our work both here in the United States as well as globally. And we do it primarily through public-private partnerships. We respond to emergencies as well as support programs and a number of things. So just to give you a hard example of the type of work that we have done during the pandemic, last year on the front end of the pandemic, in cooperation with CDC as well as some private donors, we hired over 1,000 CDC Foundation field staff that were embedded in health departments across the country. So every state health department had CDC Foundation field staff to help them surge in the moment of need. Tribal organizations, territories in the 6 largest cities. We are back again actively recruiting and hiring more staff for the health departments to help support not only the pandemic, but as a bridge to the public health workforce of the future. So that's just one example. I do want to do a shout out to Dean Halverson and the Richard M. Fairbanks School of Public Health for their recent Indiana Public Health System Review. It's a great document for us to have going into this work. And I will tell you that since leaving Indiana, I've had the privilege of serving on the Fairbanks School of Public Health's National Advisory Council, as well as the External Advisory Committee for Purdue University. So I do keep coming back home. It's great to be back to work on you, and I look really forward to diving deeply into the work of the Commission to inform the future of public health in Indiana. I'm so proud of Indiana's leadership, and I'd like to now introduce Senator Luke Kinley to have remarks.
Governor, Doctor. Well, I see a few familiar faces over here, even a few friendly ones. First off, I want to commend the governor and Dr. Box for the terrific effort they made and the leadership they provided during the pandemic. And I want to thank you, Judy, for coming back to Indiana and helping us with this commission. I told the governor in the hallway that if he had the courage to deal with this issue at this time, that I could hardly afford to refuse to help him with this. So I'm glad to be here. Indiana really has an enormous success story in the last 20, 25 years. And we have solid economic growth, and it benefits all Hoosiers. If you look at the census statistics, Indiana is far ahead of our neighboring states. Just the growth shows that Indiana is a place that people want to be. And these things don't occur by accident. And so this is a good time to review our public health system. I truly commend the governor for having the courage to do this. He could ride this out. It's not a crisis of his to solve for the long-term future, but he and Dr. Box feel we need to move forward, and I think we all agree with that, so I'm glad to be participating. There's a lot of reasons that we learned from the pandemic as to why we need to have this type of an effort. If you just look at the expenditures on health care itself, that tells you that this is a more important part of our economy. So if Indiana is going to be a leader in the future, we need to do this. And this commission is an opportunity to step forward, and I appreciate the opportunity to serve and to be involved. So thank you, Governor and Dr. Box, and Judy, I really look forward to our time together.
Thank you, Senator. Aaron, are we ready for the Q&A portion?
Yes. We will start with Kristen Eskow from Fox 59.
Good morning.
Good morning.
So I guess, is the commission going to play any sort of advisory role on the state's immediate COVID-19 response, including any potential restrictions?
This is a long-term endeavor. I would liken it to the Teacher Pay Commission, where we're going to do, as Dr. Monroe said and Dr. Box elaborated on, a very thorough, deep dive. This is not a blame-storming mission by any stretch of the imagination. Obviously, it's summer to summer in the assignment timeline, so it will also help us inform going into that budget year in 2023. Having said that, look, we've got our game plan right now to continue to work through the pandemic. So that's not what this commission or this task force is about. This is a long-term look at where we want our state to be decades from now.
Will the report issued next summer include an assessment of the state's COVID-19
Oh, absolutely.
response?
Everything will go into, yeah. You want to elaborate on that, or?
Just that we are going to look very carefully at. One of the task forces will be directed to look at the response throughout the entire pandemic and this emergency health situation, and then to make recommendations about how we as a state can be even better prepared going forward with a future emergency.
Yeah. I would just add that that's just, when we talk about the differences and the challenges and how they may be unique to, just to pick one, urban, rural, or suburban, these are factors that we absolutely are seeing right now in real time in local health departments. So yes, it will, but the goal is, where will they be 10 years, 20 years, 30 years from now?
Next question is from Steve Garbas from KPC Media. He is virtual.
Good
Steve?
morning. How's everyone doing down there in Indy today?
Everyone is doing fine, Steve. Good to hear your voice.
Yeah. Hey, I just wanted to check in and talk about, going forward with this commission. Are there some specific things that you want to look at, or some areas that you've already targeted as maybe this needs some improvement or some tweaks long term? Certainly, there's going to be a lot of discovery happening here, but I'm wondering if there's a couple topics that you're already aware of that you really are hoping the state could address over the next few years.
There absolutely are. Dr. Box, I'll ask you if you'll just go over the different, kind of the org chart as you see it now. But I will say, Steve, at the very outset, these folks will huddle up for the first time today, and then their first meeting will be in September. And so that's by design. I signed the executive order earlier this morning to get this formally underway. And those areas that we'll be looking into will evolve over time as well. But there certainly are, you've got some broad areas of interest that we'll be presenting to our stakeholders all over the state.
Thank you, Governor. I've already mentioned, I think, that we'd be looking back at the past pandemic and how we might be able to improve even our response going forward to a public health emergency. Funding for public health across the state of Indiana and across the United States has been an issue, so we'll be looking at that. How can we sustain and support our local health departments going forward is going to be very important. The governance of local health. Are we able to have all of the public health services that are required and should be required of a public health system to be able to be delivered at every county level? And do we need to have certain counties support other counties in that? Would counties like to join together to have, for instance, one food safety person that goes out and does all the inspections and licensure, or one lead person that goes out and investigates elevated lead levels? Workforce is a big problem, not just for public health, but also for clinical health in general. If you look at the predictions going forward, we will be very short of nurses and a lot of other public health positions going forward. So how do we maintain, educate, and continue to grow our workforce across the state of Indiana will be critical to our mission. And then, because public health is really focused very much around prevention, it's really important that we look at how public health services are delivered to our children across the state. Do all children have access to getting their immunizations? Do all children have access to having investigation and follow-up of lead exposure and other things that can ultimately make significant differences in their lives? So those are the big, broad strokes that we've published.
Yeah, and that's, Steve, how we approached it. I mean, we said at the very outset during the initial discussions that we had to really scratch at funding, could be disparities, funding, operations, and resources, making sure that we could best serve all Hoosiers, no matter what their zip code was or whether they're urban, rural, or suburban in terms of that both treatment and prevention.
Next question is from Nate Gould from Which TV.
Hello, Governor.
Hey, good
Why
morning.
exactly now is there a need for this commission?
Well, it's not exactly now is the need. I would rephrase the question, and I'll take responsibility for that. I think it's long overdue. We have been a little busy in the health arena, but it exposed the absolute need to take a more holistic and long-term as we're dealing with the acute, or as we're dealing with the urgent and immediate needs. They just go hand in hand. I hope that ultimately they will complement the findings of this commission, will complement other efforts that are already underway as well, and will come. Obviously, this is top of mind with our legislative friends upstairs. So we hope that our work, their work, will complement each other's end goal.
And are you satisfied with allowing individual counties to make their own decisions regarding mask mandates?
I am now. We're not in the same place that we were over a year ago. We'll continue back to making sure local communities and counties have the resources that they need, and where we can help them help themselves. We'll continue to do that. That could be in a number of examples, but I mean, obviously you're seeing this is a good thing, testing demand. And so we'll continue to look at in counties how we can be more helpful closer to the ground so that those testing results are more immediate. So yes, I am. We heard loud and clear over this last year about the need for the local control. The big number one difference is we know what works. We know what works, and that's the vaccine. We got about 51%, a little over 51%, fully vaccinated, about 53, 12 and above, eligible Hoosiers. Proof positive that the vaccine works. Now, what are the next steps that need to be taken? And if you get around the state and different areas, there are different indicators and factors that folks need to be aware of. So we'll continue to make sure that we're transparent, that we're giving the information that local communities need, and then on top of that, to make their decisions. And then on top of that, we'll make sure that we're providing them with the resources to carry out those decisions.
Thank you.
Next question is from Carolina from the State House file.
Hi, can you hear me?
Loud and clear. Good morning.
Good morning. So this commission is planning a lot of things. So what's the first thing to tackle? How soon will it start, and how soon it expects to see progress?
I'm sorry, Caroline, did you say how soon do we expect to see progress?
Yes.
Yes. Well, this is going to be a year-long endeavor. I mean, now, that's a good question because we will learn things along the way. When I mentioned this will inform the budget session, that was obviously referring to the funding part of the funding operations and resources deep dives. We will learn things along the way, and we won't wait to implement a good idea until 2023, come what may. But to say what is the number one priority, we're looking at it differently. We're looking at this going in with an open mind. Again, we're not sitting around here blame-storming for looking for who to assign a failed responsibility to. I'll take that. But what we're doing is trying to solve very localized and state structural issues that have been exposed for sure during a global pandemic. But we were in the bottom 10 before the global pandemic. And so putting together a commission like this with the expertise at hand, as Dr. Bach said, very excited about where we'll end up. But there's not just one thing that we're focused on. There are many.
Next question is from Nikki Kelly, Fort Wayne Journal-Gazette.
Nikki?
Sorry, I have a COVID question. Haven't seen you in a while. So you mentioned the testing demand is up. I had to
Yes.
get tested last week. I couldn't find an appointment. I had to wait an hour in line. Is there any consideration of starting back up the testing sites, the state testing sites?
The answer is yes. You want to take that, and there will be more to come, but I don't like to hear that. On one hand, the hour wait. We've had 2 or 3 hour waits here recently. When you look at cases in our schools and you look at a July 25th number of positive cases and you look at a August 4th number or August 1st and you start to see the cases go up and you see the demand, we certainly understand, and I'm actually, on the other hand, encouraged that people are going to get tested. Now, and that's exactly where the state will be stepping up to make sure that we can do our part, that localized communities, whether it be the health department, hospitals, schools themselves, can have a much shorter line and quicker turnaround time. You want to just share a few general thoughts before we put the specifics out?
So the demand for testing skyrocketed right about the same time. Many of our testing sites across the state were kind of decreasing the amount and hours that they were available to do testing, which we know has resulted in some prolonged waits and frustrations. So the things that we're doing to address that, we are literally pulling back many Guard members that we had given some time to be with their families after 18 months. We are in the process of supporting our local health departments. We've got 53 of 94 of them that are actually doing testing, but they need help to do the amount of testing that they're doing, so we will help to embed Guard members there. We are also in the process within our own agency of pulling back, clawing back everybody that was involved with testing and vaccinations in our Department of Health from their routine jobs so that they can get us through this Delta surge. And when the governor mentioned the numbers going up, you know, on July 25th, we had, at the end of that week, 1,500 kids ages 0 to 19 that were positive for cases. 2 weeks later, on August the 8th, that number was 4,200. It's a huge difference, and a big part of that is kids that are symptomatic, whose parents are concerned and want them tested. Kids who have been sent home because they had a headache or a stomach ache, and in order to get back into school, they need to be able to have a negative test. Kids that have been quarantined because of a close contact and they weren't masked, and so they've been sent home, and now they want to get tested to get back into school. So we recognize this and are working very hard to bring on board another agency, not a state agency, but another group of healthcare professionals that could help us to do testing in schools, because we believe as we go forward, even as this Delta surge comes down, what we're going to see is that more cases of RSV, more cases of influenza are going to complicate the picture of whether this is COVID, whether this is influenza, whether this is RSV, and individuals are going to want to be able to be tested and rule out COVID. So we're in the planning stages of that and should hopefully make that decision in early September and have them in place, I would hope, in October. So lots of things going on in that, and I really apologize for the waits. I know it's frustrating. We also are turning over every single vaccine site. We're asking them not only to do vaccines, but also to make sure that they will do Bionex Now testing and PCR testing with swabs. Thank you.
And training. I mean, will we? Yeah, but Nikki, you actually just beat us to the punch by a couple days. So when she mentioned September, October, we'll have more to share on bringing more resources closer to the local demand shortly.
Brandon Smith from Indiana Public Broadcasting.
Morning, Governor.
Good morning.
I have a question on the commission. So over the last, 18 whatever months of the pandemic, we've seen large groups of Hoosiers no longer trusting public health officials. We saw lawmakers taking power away from local health departments. So how can this commission empower and improve those local health departments when you have all those forces working against them?
Well, that's Senator Kinley. I think he hit the nail on the head. We're going to work each and every day, all of us, on making sure that folks are best informed, most equipped to make good localized decisions with state support. That's not evading your question, but that is central to this all. And there's, I can't do anything about the global social media myth spreaders. But what we can do is make sure people have good, localized, trusted, verified state information. And I have never been prouder of our healthcare professionals, locally and at the state, federally, to make sure that we're putting out data that has integrity. And that will be part of this next year's assignment, is to make sure folks know where places that they can trust to help guide them. Folks are frustrated because of so many variants and the twists and turns, and we get that. And whether it's standing in a line that's real and near term, because the level and the waves kind of come and go, so do our resources. We don't want to overdo it in an area and waste resources. And so this is, both hands are on dials, and we got to make sure we're getting through this just as we did that first initial wave when we had no PPE and when we had to first stand up testing sites and tracing, et cetera. But absolutely, the communication of real, true data is critically important to this for Hoosier families.
Rich Nye, WTHR.
How overwhelmed are local public health departments with all the additional responsibilities that have been added during the pandemic?
Well, you could probably, Dr. Monroe, speak to that across the whole country. We're not alone in this, but overwhelmed might be an understatement depending on when you ask the question over the last 18 months. Obviously, as waves come and recede and come again, that's taxing. The other thing that is taxing for our local health departments and nurses, nurse assistants, doctors, and this is a frustration as well. And this is not the first time I've said this, but I do stand in awe about those in the healthcare profession, because they know what works. And the very folks who are now seeking treatment, by and large, almost 97, 98, 99%, depending on if you're looking at hospitalizations or folks in an ICU, we know the vaccine works. And that is the first answer to getting our way, not just through this, but out of this. And so that's overwhelming. When you see person after person after person, in terms of those numbers jumping, and you see 100 in a week period, 137 out of 137 folks in an ICU that are unvaccinated, that's overwhelming. And so it's not just what we can do, it's what you can do to solve the problem. We need you to do the right thing, and that's get vaccinated. And that will keep our kids in school. That will keep our businesses open. And we'll continue, as Senator Kinley said, we'll continue as a state to knock the cover off the ball economically as well.
And is the access issue deeper at a rural level or an urban level?
For getting the vaccine?
No, I'm sorry. Overall, for one of the goals of this commission is to make sure that everyone has equal access or good access to healthcare.
No. I mean, it's we're looking at all. This is not a it's a deeper in rural or urban or anywhere in between. This is, we're going to look at our whole state and the different terrains. And we want to make sure that every Hoosier, regardless of their zip code, has access to good health care and can make decisions that help grow our state and their family.
Thank you.
Next is Eric Berman from WIBC.
Hi, good morning.
Good morning.
Two related questions. A couple of you have referenced the various areas in which we're bottom 10 behaviorally, obesity and smoking and so forth. Is this commission going to address those kinds of things?
Absolutely.
And solutions for those, or is this purely structure, governance, funding, those kinds of things?
Well, those are outcomes, the former, the funding, the operations, the structure. We want to make sure that we have the best structure in place that can lead to bringing down those numbers in terms of, and it could be infant mortality, which I use as a good example, or it could be, yes, smoking, childhood immunizations. I mean, all the above. So no, we're not prioritizing one over the other on that front either.
And so related to that, how specifically have those structural issues impeded the pandemic response? And we know about PPE shortages, but the structural issues.
Not trying to evade your question either, but that's what this year's about. That's what we're going to get at. And going in it with an open mind, with a very commission that represents the whole state, different disciplines, different backgrounds, different perspectives, and we'll find that out.
Thank you.
Next is Whitney Downard from CNHI.
Good morning.
Good morning, Whitney.
My question is, how are we going to get the legislature to buy in? I know Brandon asked about the public, but my question is specifically about how we're going to implement any of these recommendations if the legislature has done very little on maternal mortality, the teacher pay commission wasn't really considered until the last minute earlier this year. How are we going to get the legislature to buy in?
Well, we'll continue to work with them as we do on every other issue. By the way, I think we ended up this session with one of the best budgets I've ever seen. We got a lot of work to do, and we're equipped to do it. We've got the blueprints and the financial wherewithal to do things that other states can't. So this is unlike any other issue. Actually, the teacher pay commission, it may have seemed like things came together in the last minute. That could be an observation on a lot of issues too, but I guarantee you there was a lot of work going on every single day, maybe under the surface. And so that's the nature of our process. And again, I've spoken with many legislators, members, leaders. We're all interested in this. And so I hope what we bring to the table, again, complements and is persuasive. That's another really important point about this commission going around the state. We actually will be soliciting participation and not just being there, but actually your good ideas. Because this is about solving, not leaving it for someone else.
And so you don't really have any concerns about getting legislature buy-in?
It's my job. My goal is going to be to put forth solutions that are persuasive, that they in turn feel proud about as well, that lead to a better outcome. I don't think anyone is content with being in the bottom 10 in very much of anything. I'm certainly not. And so that's going to drive me.
Thank you.
Yep, thank you.
Next question is Casey Smith from the AP.
Hi,
have another quick COVID question. We're hearing from hospitals around the state again that they're coming under strain.
Yep.
I'm wondering what your thoughts are on that, especially as the Delta variant is surging, and what kind of responses might be considered.
Yeah, Dr. Box, you might want to share some of your more recent discussions. We track it every day. We understand the pressure that they're in. I mentioned or alluded to at least some of the frustration when I'm talking to folks that we're dealing with people who are non-believers, unvaccinated, could have avoided this. Now they're believers because of the situation they find themselves in. And that becomes a very scary situation. And for the individual who very simply could have avoided it. But we are tracking those numbers. We do see we're about a third of the hospitalization rate as we were in November, December time period. But you might want to speak to that kind of the 19-year-olds and the positive cases that we're seeing more and more of in terms of hospitalizations as well, or what hospitals are willing to do to help us vaccinate as well.
So we're in constant contact with our hospital association and with hospitals across the state. They know how to work together. They've had 18 months to figure out how to work together as a region to be able to transfer patients to a different ICU or a higher level, to be able to work with EMS to make sure that we have what we need for every Hoosier to get the optimal care that they need. The biggest thing our hospitals are facing, quite frankly, is a workforce shortage. Staffing is a huge issue. A lot of times it's not about not having beds, it's about not having the people to staff those beds. And that's a critical issue, not just in the state of Indiana, but around the United States. And we've lost a lot of public health officials related to that also. I will say that what happens is, right now, it doesn't appear that the Delta variant is more severe necessarily in our children, but just by the nature of the fact that we have so many more cases in our 0 to 19 age group, we have more youth hospitalized. But again, if you look at our hospital census, our #1 hospitalizations are in our 60 and above, and then you can look and the next line is a 50 and above, and the next line is a 40 and above. So it is very much an age-related thing. But I do want to underscore what the governor said, and that is, less than 3% of our hospital admissions are breakthrough cases. 97, 98% of those cases in our hospitals and in our ICUs are people that have not been vaccinated. And that's the answer. And I can't tell you how many times I've heard the heartbreaking story, which I'm sure you have all heard too, of the individual that comes in and said, I meant to get vaccinated. Can I get vaccinated now? And really, when they're sick in the middle of their sickness, it's too late at that moment to get the vaccine. So I encourage you to get vaccinated. That's the way that we're going to get control over this pandemic. That is the way we're going to win over this virus.
Sherry Rudofsky from Indy Star.
Morning, Sherry.
Hi, thank you, Governor. I have a question that kind of brings together the unvaccinated, I won't say masses, but certainly very large minority in our state, and it's kind of holding steady. I mean, when you look at the lines, we're really not, despite.
That's right.
I know you guys have calls out all the time, you're doing mobile clinics all over the state. It's not unlike the legislature, which year after year, since I've lived in the state, which has been almost 2 decades, has declined opportunities to fund public health initiatives. I know that happened when Dr. Monroe was here. I'm sure you've seen requests, and they just don't seem to have an appetite for it. How is the commission going to change people's attitudes and approaches when it comes to public health?
Well, we're going to present the facts. Hopefully the truth will set you free, and you'll maybe take a different second look at the facts. That's why I say we're a year away from those answers. We'll learn some things along the way. We'll share along the way, but this is not just about us or the legislature. This is about addressing a system, which can at times sound boring, or mundane or not a priority, or we need to focus on something else. But I think it's becoming clearer and clearer with every year that passes by. As Senator Kinley ticked off a kind of a short list, this is an area that holds all those other high rankings, which there are many. I won't pull my string and recite them all to you, but this is something that weights those down, that prevents us from reaching individual and our state of our true potential. And hopefully the work that goes into this, first and foremost, leads to better health. And the system isn't part of the problem that leads to better health. And there'll be some facts associated with that, only facts associated with that endeavor, that I think will be persuasive. And certainly, this isn't just about increasing business, but certainly if you go out and talk to our business community, they will tell you, I need a healthy workforce. There are folks struggling with addiction right now. So that's an area we haven't talked a lot about, but that's very important in this whole equation and endeavor. And absolutely everything else is as well, but hopefully the facts will be the persuasive part of this assignment.
This concludes today's press conference. Thank you.